For people suffering from back pain, there can be many conditions behind the pain, and getting a correct diagnosis, let alone a treatment, can be incredibly stressful. Well, today we're taking a closer look at one such condition, and Dr. Sunil Panchal from the National Institute of Spine and Pain joins us now. Doctor, welcome to the show. How are you?
Very good, thank you.
I am. Let's go ahead and dive in. I'm glad we're talking about this today because I feel like it can be so frustrating for people who are living with pain. So what are we talking about today? What is the condition that we're going to focus on?
Sacroiliac joint degeneration, or sacroiliitis, is a common condition for low back pain. Approximately 1/3 of patients with low back pain have involvement of the sacroiliac joint.
You know, so many times you hear these things and you think the only option is surgery. So let's kind of dive in and talk a little bit about some treatment options that you would like people to know out there that do exist out there.
So when it comes to chronic back pain, what we look at are ways to treat the source of the pain so we can avoid medications or side effects from medications. One of the things that we do can be, at the beginning, you may inject a steroid to reduce inflammation in the joints, whether we do it for the spine or hips or knees. There are some targets where we may be able to knock out some of the nerve endings with a radiofrequency treatment. And then beyond that, to get a more definitive treatment for severe pain, we may end up doing a minimally invasive surgical procedure.
Because it seems like getting the correct diagnosis with what we're talking about today really seems key, and sometimes that may not happen, which again would then not be able to have the right treatment like the ones you just discussed.
That's correct. So when it comes to back pain, a lot of patients will undergo surgery and end up disappointed with the results. And the underlying problem is not getting the right diagnosis up front. So when it comes to patients with back pain, we want to make it distinguish and identify whether the pain is in a pattern of a pinched nerve or in a pattern of the joints of the spine. So an example is that if you have pain from a nerve that's pinched, let's say the L4 nerve or L5 or S1, your symptoms should radiate into your foot. And they're particular well-described patterns. Whereas joints of the spine will cause pain to radiate down the leg as well, but it won't extend past the ankle. So if you've been given a diagnosis for a pinched nerve and your symptoms don't go past the ankle, you should really look into it more carefully.
And again, that's of course getting that correct diagnosis. You discussed the treatment options, and we're actually going to take an even more in-depth look of this one treatment option that we wanted to address today, right?
Yes. So one of the options for doing the surgical procedure for this is going to allow us to go ahead and fixate and also cause a fusion of the joint. So when you look at the sacroiliac joint, the actual joint surfaces can't fuse unless you remove the cartilage. So this is a system here where we'll place a small pin, small little tubes to create a little pathway for our instruments, and then we can insert an instrument to get between the sacrum and the iliac joint space and remove the cartilage. Then it allows us to place some bone graft in that space, and then we place 2 small screws to hold it together and give it time to fuse.
Can I ask about recovery time when it comes to the procedure we just took a look at?
The recovery is pretty well tolerated. The pain from the actual surgical procedure will probably bother patients for about 3 to 4 days.
Okay.
A little bit of medication usually takes care of that. You'll have a little bit more soreness in the soft tissue, which may extend for another week or so. And then from a recovery standpoint, in terms of activity, the only really restriction is we ask patients to use a walker for 6 weeks to limit weight bearing on there and give it time to really get hold together and heal. The incision is only about 1 inch to 1.5 inches, so it's a minimally invasive procedure.
Don't you think overall, I mean, just trying to find that correct diagnosis and then be able to have a treatment that's not going to keep people down for months, I'm assuming you always get the relief from the patients that you work with, don't you?
Yes, it's really rewarding to see the results that we get from this. I'm sure.
Well, we want to make sure and share the contact information, so of course you can get in touch with Dr. Panchal and his team today. And again, we're so glad we were able to meet you and talk about this and hopefully bring relief to viewers that are out there. Again, nationalinstituteofpain.org is where you can go for even more info.
Thank you.